Hello everyone, my name is Michaela Antelak, and my research proposal is based on the treatment of and associated risk factors for oppositional defiance disorder in children. Working with children for the past 2 years, I have observed a common theme of anger and defiant behaviors. Anger and defiance are manifestations of conduct disorders, more specifically oppositional defiance disorder, or ODD for short. ODD is a mental health disorder commonly diagnosed in children that display patterns of angry, irritable mood, argumentative, defiant behaviors, or vindictiveness lasting for at least 6 months. According to research, ODD diagnoses have increased by almost 43% in the United States between 2004 and 2013. As a clinical social worker, I am proposing that research be conducted on the origins of ODD and the risk factors that contribute to its development to gain a better understanding of how ODD manifests in children. Considering that there is a lack of research comparing the efficacy of cognitive behavioral therapy and dialectical behavioral therapy in treating ODD in children, this writer also proposes that research be conducted on the efficacy of these modalities to determine which treatment approach yields the greatest decrease in ODD symptoms. Specific interventions should be discussed to assist clinicians in identifying interventions that effectively reduce anger and defiance in children. This research proposal aims to address the following questions. In children with oppositional defiance disorder, is dialectical behavioral therapy more effective than cognitive behavioral therapy in reducing anger and defiance? Are there specific dialectical behavioral therapy interventions that are more effective in treating oppositional defiance disorder in children? What factors are contributing to the increase in oppositional defiance disorder diagnoses among children? One study suggests that children living in low-income households are more likely to be diagnosed with oppositional defiance disorder. The rate of oppositional defiance disorder diagnoses among all Medicaid enrollees has increased by 69% between 2001 and 2010. Is there a connection between poverty and oppositional defiance disorder? Attachment and social learning theories can help explain the development of oppositional defiance disorder in children. Attachment theory is the theory that infants develop an attachment with their primary caregiver. According to studies conducted on attachment styles in children, children with an insecure or disorganized attachment style are at a higher risk for developing oppositional defiance disorder. Social learning theory is the theory that individuals learn new behaviors by observing and imitating others. Oppositional defiance disorder in children is largely considered a learned behavior, where negative behaviors are reinforced through interactions with others, specifically caregivers. There are theoretical frameworks that support cognitive behavioral therapy and dialectical behavioral therapy interventions that may assist researchers in determining which modality is more effective in treating oppositional defiance disorder. Cognitive behavioral therapy is supported by cognition theory, which is the theory that thoughts and beliefs can impact emotions and behaviors. Cognitive behavioral therapy strives to help clients reframe negative thoughts and beliefs to aid in the reduction of negative emotions and behaviors contributing to mental health symptoms. Dialectical behavioral therapy is supported by biosocial theory, which is the theory that human behavior can be explained by biological predispositions that are influenced by social or environmental factors. Dialectical behavioral therapy aims to teach clients skills that regulate biological reactions to emotions to aid in the reduction of emotional dysregulation. According to the literature, Numerous factors contribute to the development of oppositional defiance disorder in children. Demographically, researchers have observed the presence of oppositional defiance disorder symptoms more commonly in males than females. It is also identified that low maternal education, single or step-parenthood, and non-European descent were associated with a greater risk for developing oppositional defiance disorder. Additionally, a correlation between parent executive functioning, parenting styles, and oppositional defiance disorder in children was discovered. According to the literature, children are at a greater risk for developing oppositional defiance disorder if their mother is low functioning and implements harsh parenting. Furthermore, general stressors were linked to the child's risk for developing oppositional defiance disorder. Children who are raised in home environments that were subject to multiple social, economic, and related adversity, including maternal smoking, socioeconomic disadvantage, family instability, and parental adjustment problems, are at a higher risk for developing oppositional defiance disorder. The manifestation of oppositional defiance disorder symptoms in children was also discovered to be associated with negative life events, such as exposure to child abuse and family violence. It's also important to note that children displaying oppositional defiance symptoms are more likely to affiliate with delinquent and substance-using peers and may be of a lower cognitive ability. Considering that this research proposal examines the efficacy of cognitive behavioral therapy and dialectical behavioral therapy in treating oppositional defiance disorder in children, a review of the literature analyzing these interventions for oppositional defiance disorder was conducted. During this time, an abundance of studies was located that found both cognitive behavioral therapy and dialectical behavioral therapy individually to be effective in decreasing the severity of oppositional defiance disorder symptoms in children. It is important to note that each child will have unique needs that may require a specific approach, or potentially an integrated approach to treatment. Researchers highlighted that integrated approaches can potentially yield better results in treatment. Although there was an abundance of studies that found both cognitive behavioral therapy and dialectical behavioral therapy individually to be effective in decreasing oppositional defiance disorder symptoms, no studies could be located that compared the efficacy of cognitive behavioral therapy and dialectical behavioral therapy when treating oppositional defiance disorder. This lack of research indicates the need for research that compares the efficacy of these two interventions when treating oppositional defiance disorder in children. Researchers should implement a true experiment mixed methods research design when studying the efficacy of cognitive behavioral therapy and dialectical behavioral therapy in treating oppositional defiance disorder. Researchers will test the causal relationship between treatment modalities and oppositional defiance disorder symptoms. Researchers should document observations of client behaviors and monitor treatment using a diagnostic tool. Utilizing a diagnostic tool will make client progress measurable and assist researchers in continuously monitoring oppositional defiance disorder symptoms. Once data is collected over a period of time, researchers will compare observations and diagnostic measurements from the beginning and end of treatment to assess the efficacy of cognitive behavioral therapy or dialectical behavioral therapy interventions for each study group. Whichever group yields the most treatment progress will be concluded as the most effective in treating oppositional defiance disorder symptoms in children. The target population of this study is children with oppositional defiance disorder. The sampling frame will consist of 100 children under the age of 18 who are enrolled for therapy services at an outpatient mental health clinic and have been diagnosed with oppositional defiance disorder. Researchers will utilize a probability approach to sampling to ensure that study results represent all children displaying oppositional defiance disorder symptoms. More specifically, researchers will utilize a simple random sampling method where study participants are selected only based on chance. The procedures and measurement of this research proposal should go as follows. Researchers will randomly select 100 children diagnosed with oppositional defiance disorder at an outpatient mental health clinic. These 100 children will be randomly assigned to cognitive behavioral therapy or dialectical behavioral therapy interventions. Researchers implementing interventions will meet with clients once a week over the course of a year. During this time, researchers will document observations weekly and assess oppositional defiance disorder symptoms using the Child Behavior Checklist monthly. To ensure that reported behaviors are as accurate as possible, the Child Behavioral Checklist will be completed with both the client and the caregiver present. At the beginning of treatment, an intake and baseline measurement will be completed to determine the baseline for treatment. At the end of treatment, an exit interview will be completed, where a final measurement is taken to determine the outcome of treatment. These measurements, along with documentation and monthly assessments, will then be compared to determine the efficacy of treatment. Both cognitive behavioral therapy and dialectical behavioral therapy groups will then be compared to determine which modality was more effective in treating ODD in children. Researchers implementing cognitive behavioral therapy interventions into treatment will focus on assisting clients with reframing negative thoughts and beliefs, contributing to emotional dysregulation. These clinicians can implement thought-stopping techniques to assist clients with controlling impulses and teach clients problem-solving skills to enhance their ability to respond more effectively to conflict or negative experiences. Researchers implementing dialectical behavioral therapy interventions will focus on teaching mindfulness and distress tolerance skills to aid in the reduction of emotional outbursts. These skills can include TIP skills, which are skills that assist with mood management by regulating biological reactions to intense emotions. Clinicians can also assist clients in identifying their triggers, learning relaxation techniques, and communicating effectively. There are a few limitations to consider when conducting research on children. It can be difficult to collect data from caregivers due to the varying definitions of defiance. Some parents may over or underreport behaviors depending on their perception of defiant behaviors. There is also a risk that caregivers could be inconsistent with attendance. Poor attendance can significantly impact progress in therapy and result in study participants dropping out of the study. Lastly, it is important to consider the impact that external factors have on participant behaviors. For example, a child experiencing domestic violence at home may not be as receptive to therapeutic interventions and skew study results. It is also important to note that limitations presented by the proposed methodology of this study. The study proposes the use of a simple random sampling method, which can introduce bias if randomly selected participants don't accurately represent the population. Researchers should ensure that a diverse population is selected to increase generalizability. This study also proposes that researchers use a mixed methods research design, which can add complexity and be more resource intensive. Researchers should consider these limitations when conducting research and translating research findings. Additionally, when conducting research on children, there are ethical implications to consider. Children represent a vulnerable population, and researchers should prioritize their vulnerability by collecting informed consent from both the child and their caregiver. Researchers should only conduct research on children who can understand the research process and exercise their right to withdraw from the study at any time. Researchers should also take extra measures to ensure that they are protecting study participants' privacy and minimizing potential harm. According to research, there is a growing prevalence of children displaying symptoms of oppositional defiance disorder. These children can be considered difficult to treat due to their defiance and resistance to treatment. Researching effective interventions for treating oppositional defiance disorder in children can be considered research-informed practice and can provide clinicians with the knowledge and skills they need to provide effective interventions for children displaying symptoms of oppositional defiance disorder. Identifying and being able to provide effective evidence-based treatments for oppositional defiance disorder in children will promote a better quality of life for both the child and their families. To further research on effective interventions for children with oppositional defiance disorder, researchers should consider the efficacy of other modalities outside the scope of cognitive behavioral therapy and dialectical behavioral therapy. When conducting a literature review, it was determined that social skills training and mother-child attachment therapy were also effective in decreasing oppositional defiance disorder symptoms in children. It was also discovered that there was a strong correlation between oppositional defiance disorder and ADHD symptoms. Researchers should consider examining this correlation to determine treatment options that address this comorbidity. Additionally, it was discovered that parenting styles, negative life experiences, adversity, cognitive ability, and negative peer influences directly impact the development of oppositional defiance disorder. Future research should continue to examine these factors and how they contribute to the development of oppositional defiance disorder in children. Listed on this slide and the next slide are my references. Thank you for watching my research proposal presentation on the treatment and risk factors associated with oppositional defiance disorder in children. I hope you have an amazing day.